Hi, my name is Raanan, and I'm going to be doing a presentation on alcohol abuse and some of the treatments that people can utilize. An introduction to alcohol. So, alcohol is the most commonly used substance in the U.S. It is used for recreational purposes. It's currently legal, but despite that, it can cause physical, psychological, and social harm if it's misused. The chemical compound is called ethanol, and it usually comes in beer, wine, or spirits, which have the highest concentration. Other names that you commonly hear include liquor, booze. Alcohol is a CNS depressant, and it increases GABA A activity, causing calming and sedating effect. It affects multiple systems in the body, includes the brain. It's toxic to the liver, the heart, and stomach. It's made via fermentation, and currently there's on the DSM-5 diagnosis. There's three separate ones you can make. You have alcohol use disorder, alcohol intoxication, and alcohol withdrawal. A history of alcohol. So there's a long history of alcohol. It dates back to 10,000 years ago. Evidence of it is found in ancient China, Mesopotamia, and Egypt. It's used a lot for celebratory purposes, healing ceremonies. In America, there was a prohibition from 1920 to 1933 with the 18th Amendment, which made alcohol legal. It's well documented throughout many cultures in U.S. history. Today, alcoholism, the term, and alcoholic are stigmatized terms and can prevent treatment, which coined alcohol use disorder. So, alcohol currently has the highest usage rate out of any other substance. The majority of the usage is for recreational purposes, but some people kind of spiral and go into an abusive state. Some of the common things that you'll see with alcohol use disorder is binge drinking, which is excessive amount in a short period of time. This is very dangerous. Alcohol use disorder has 200,000 annual hospitalizations and makes up 7.5% of emergency room visits. It affects about almost 30 million people, and that's from ages 12 and over. And out of that number, only 7.6% receive treatment. Current risk factors in vulnerable populations associated with increased alcohol abuse include people who have psychiatric comorbidities. Bipolar has a very high comorbidity with alcohol abuse. People with PTSD, including war veterans. People who have panic disorder, anxiety disorder, because it helps them relieve their symptoms, and people with depression. Psychosocial factors can include stressful events such as losing a home, losing a job, divorce, and being socially isolated. Environmental factors includes poverty, a history of incarceration, and inequality treatment. Some genetic components they carry a high risk. If there's a family presence of drinking, there's almost 50% chance that you develop drinking as well. There's also specific cultural factors. Some cultural populations celebrate with alcohol use more than others. People who have a history of drinking at a younger age have a higher risk of abuse in the future, and people who have a history of impulsive behavior and a history of trauma are all people who have an increased risk factor for developing alcohol abuse. So, the short term side effects from drinking alcohol include intoxication. This results in functional impairment, poor coordination, slurred speech, loss of balance, um, loss of memory, and blacking out. It also includes feelings of euphoria and decreased anxiety. Some behavioral issues that might be seen includes increased aggression, mood changes, judgment impairment, poor decision making, such as driving your car, and hallucinations, but those are more rare. Heavy use can result in renal failure. Central nervous system depression can lead to a coma. This is further increased if it's mixed with other sedatives such as benzodiazepine, which would include blood levels greater than 300 milligrams per deciliter. And finally, another short term side effects is there is an increased suicidality risk. Long term side effects is going to be multisystemic. The gastrointestinal system is can develop hepatotoxicity, includes cirrhosis of the liver. That would show up with liver function tests, hepatitis, jaundice, pancreatitis, and esophageal varices. Hematologic include nutritional deficiencies such as B12 and folate, which can cause anemia, and then you have thrombocytopenia. Neurologically, if people become thiamine deficient, they can get Korsakoff syndrome, and dementia is another long term risk factor. Cardio, hypertension, atrial fibrillation, and there's an increased risk for coronary artery disease. People who drink also are at risk for developing obstructive sleep apnea. They're also at a higher risk for developing various infections, and drinking can also lead to physical injuries because people can get into fights and falls, and they have an increased risk for suicidality because their mentation and their judgment is not straight during while they're intoxicated. And finally, people can develop a tolerance to alcohol after long term use. In addition to short term and long term side effects, when people stop drinking, they also experience withdrawal symptoms. This depends on the amount and the length of time that they've been drinking. Withdrawal symptoms usually can start several hours after the last drink, with a peak period of about 72 hours. Um, Side effects would include with increased activation of the autonomic nervous system. This can include sweating, tachycardia, and tremors. People also experience insomnia, nausea and vomiting, hallucinations. Tactile hallucinations are very common. Delirium tremens, anxiety, and seizures if the withdrawal is severe. The potential for overdose are used as a suicide weapon of choice. So there's a higher lethal potential when it's abused with other sedatives like sleeping pills, benzodiazepines, or opioids. Binge drinking has one of the higher probabilities for overdose. Usually, you see respiratory depression and people can fall into a coma. There's also a high risk for suicidal behavior, which increases depending on the amount that the person drinks. The more they drink, the higher chance of suicidal behavior. It also enhances feelings of depression, aggression, impulsivity, judgment impairment, reckless behavior, and a decrease, a loss of fear of dying. It disrupts relationships, and it's most likely used in suicide if the person who's drinking also has access to a firearm. So, treatment includes depending on where people are after they stopped. So, acute is the initial cessation of alcohol, which for a lot of people comes with withdrawal symptoms that would require detox. Acute detox is usually based on the withdrawal symptoms. Usually, the CWA is the popular scale that people use, and they usually use benzodiazepines to control the symptoms, such as lorazepam, diazepam, and Librium. In addition, propranolol, clonidine, some of those can help with some of the tremors. And the goal is to treat the side effects and prevent seizures. For chronic treatment, you have naltrexone, which is a first line. It decreases craving. You have Percet, which is another first line for alcohol use disorder. It's an NMDA antagonist and GABAergic agent. And then a second line is disulfiram, an acetaldehyde dehydrogenase inhibitor. It basically, if people drink, they will experience some pretty unwanted side effects. So the goal is to give them some negative reinforcement to prevent drinking. Some non pharmacological treatments include performing an assessment to figure out how much an individual drinks. That way, you could determine a good treatment plan for them. The Cage scale is one assessment, and it could also be made if drinking is suspected. It's pretty reliable. Um, Treatment includes inpatient, outpatient rehabilitation, inpatient, non pharmacological. There's support during the withdrawal period, monitoring patient safety, being a motivating figure, maybe getting them like warm blankets. For outpatient, this is usually after the detox. You could start things like psychotherapy, which includes cognitive behavioral therapy. Family therapy may also be needed to support them because usually other people are affected as well. Then you have support groups, that's your Alcoholics Anonymous. Patient would require continuous screening assessments, and it's usually good to have support systems in place as part of treatment. Patient education depends where in the treatment they are. For acute, it's good to talk to patients about the CWA score, how they're going to be getting their medications to manage their withdrawal symptoms, answer any questions because it is a difficult time for them. The chronic treatment, naltrexone, your first line, that's an opioid receptor antagonist. Patients should know that it can work from days up to weeks. It decreases the reward activity. There's some side effects of nausea, decreased appetite. They could also increase anxiety, and the injection site might have pain or it could get infected. Compressor reduces glutamate and increases GABA. It could have an effect on people's mood, increase anxiety and depression. Can also cause suicidal ideation and comes with nausea and diarrhea. Second line treatment, disulfiram. The goal is to maintain abstinence. So if alcohol is ingested, they're gonna feel terrible and might have some tachycardia, flushing. Their face could turn red. Might get really sick. But normal side effects just from taking the medication include metallic taste, sedation, and dermatitis. And good patient education also includes the importance of medication adherence, and that includes all their psychiatric treatments. You want to make sure that they're treating their comorbidities as well. Attending therapy, attending their support groups regularly, incorporating physical exercise, and practicing a healthy diet. Referrals start with inpatient. depending on the severity of the withdrawal, that this would require someone for a 24-hour supervision. You also want to refer them out to the medical team because they might have a lot of comorbidities. So your GI doctor, um, addiction specialists are also very important. People that are trained in managing these types of patients. So somebody who can manage the medications and is very well knowledgeable of that, if that would be a good referral. And then a therapist who specializes in substance abuse treatment. There's also faith-based recovery groups that some patients might prefer a referral to. Social services can help them with housing, getting jobs, transportation, and counseling services to help them maintain abstinence. Follow up includes three phases. You have the initial phases, which the initial phase is when people are just out and starting their treatment. You want to monitor their medication efficacy and side effects, and you want to monitor their withdrawal and adherence. This would require weekly monitoring. Once they're a little more stable after 4 weeks, you could put them on a monthly scale. And this would focus on coping and relapse prevention. Once they get into a maintenance, this is usually within a year of sobriety. They require quarterly appointments. Then you want to do continued care. This would include relapse evaluation and abstinence support. Always follow up, make sure that they're adhering to medications, and assess patients for new stressors in their lives. In conclusion, recreational alcohol use is currently, it's always been culturally accepted as a recreational substance. It's important to practice responsible drinking. Public education awareness is also a big critical factor with this disorder. Alcohol abuse prevention, coping strategies, helping patients or people cope with their lifestyle stressors to prevent drinking, educating populations that do have a high risk. The best treatment approaches are currently early identification and early intervention. Good practice also includes therapeutic communication, empathy, approaching patients non judgmentally, and of course, patient safety.